Hello, NephU community. My name is Dr. Saba Gade, Senior Medical Science Liaison with Otsuka Pharmaceutical Development and Commercialization. I'm here today with Dr. Ehsan Nobakht to discuss the diagnostic approach to patients with ADPKD. Dr. Nobakht is a nephrologist and a faculty member at the Division of Nephrology at George Washington University in Washington, D.C. Thank you for joining us today, Dr. Nobakht.
Hello. Polycystic kidney disease, or PKD, is a group of heterogeneous disorder that result from a single gene mutation transmitted through an autosomal recessive or an autosomal dominant fashion. Autosomal dominant polycystic kidney disease, or ADPKD, is the most common form of PKD. ADPKD is the most common hereditary kidney disease, occurring in 1 in 500 to 1 in 1,000 live births. In addition to bilateral kidney cysts, there are manifestations of ADPKD beyond involvement of the kidney, including cysts in other organs such as pancreas, liver, seminal vesicles, and arachnoid membrane. There are also non-cystic manifestations of ADPKD, such as intracranial aneurysms, aortic root dilatation, and abdominal wall hernias. Unfortunately, ADPKD can lead to end-stage kidney disease. In fact, ADPKD is the fourth leading cause of end-stage kidney disease in the United States. So it is very important to be able to differentiate ADPKD from other kidney cystic diseases, as there are non-pharmacological as well as clinically proven pharmacological intervention available for patients with ADPKD. Therefore, establishing a diagnosis can be life-changing for these patients. How can we make the diagnosis of ADPKD? Kidney imaging, such as kidney ultrasound, is the mainstay diagnostic tool. Having certain number of cysts, which is age dependent, in an individual with the known family history of ADPKD is diagnostic. However, it is not uncommon to be in a situation that there is no clear family history of ADPKD, or the number of the cysts are borderline, or the kidneys are not enlarged, or there are some atypical features such as asymmetric kidneys, which can make the diagnosis uncertain. On the other hand, there are other kidney cystic diseases, such as simple cysts, acquired kidney cystic diseases, tuberous sclerosis, polycystic liver disease, or von Hippel-Lindau. So not everyone with cyst in the kidney has ADPKD. Also, a normal kidney ultrasound does not exclude ADPKD, and sometimes more sophisticated kidney imaging, such as MRI, is considered to establish the diagnosis. In addition, MRI with the measurement of total kidney volume can be used since it may impact the management of patients with ADPKD. So what should we do when we approach someone with kidney cysts? The real challenge is how to determine whether an individual without known family history of ADPKD is in fact affected with ADPKD. Genetic testing is increasingly becoming as an effective and definitive diagnostic tool to help us with evaluation of those individuals suspected for ADPKD, where there is a diagnostic uncertainty. Also, genetic testing can be used for kidney-related donor evaluation, prenatal, and also pre-implantation genetic testing. A panel for genetic testing for cystic kidney disease should include genes such as PKD1 gene, PKD2, PKHD1, and genes involved in the function of the cilia and many other relevant genes. Also, genetic testing for a truncating type of mutation of PKD1 can help to identify those individuals who are at risk for developing rapidly progressive disease, as this may impact the management of these patients with regards to pharmacotherapy. Let's have a clinical scenario. A 32-year-old lady is referred for evaluation of microscopic hematuria. Renal ultrasound shows bilateral cysts. There is no known family history of kidney disease. In addition to offering kidney imaging of the parents, I would suggest genetic testing, because a small percentage of the patient with ADPKD has de novo mutation. In summary, not everyone with kidney cyst has ADPKD. There are pharmacological and non-pharmacological interventions available for patients with ADPKD. Therefore, establishing an accurate diagnosis is very important, and genetic testing can be considered to establish the diagnosis.
I want to thank Dr. Nobakht for joining us today. That was a great discussion on the diagnostic approach to patients with ADPKD. Thank you also to the NephU community for tuning in, and we hope you enjoyed the discussion. We will see you next time here on NephU.